Why you're bloated, how to fix it. Bloating is a normal part of digestion, but sometimes it can be uncomfortable and bothersome. Today, we'll explore 5 common reasons why we experience bloating and what we can do to alleviate the discomfort. Now, let's get started. When we eat, food travels to our stomach where it's broken down into smaller pieces, then moves to the small intestine for nutrient absorption. Whatever remains undigested heads to the large intestine, or colon, where healthy bacteria feast on it and produce gas as a byproduct. This gas can cause that tight, gassy feeling in our abdomen. Here are 4 foods that can help relieve this discomfort. Ginger, as a prokinetic. Ginger promotes movement in the digestive tract, helping to relieve pain from gas buildup. Add it to curries, smoothies, or hot water. Fennel seeds, containing anethole. Fennel seeds relax the digestive tract, release gas, and reduce inflammation. Use them in teas, soups, or salads. Peppermint, known for its calming effect on the digestive tract, peppermint, especially in oil form, can help reduce bloating. However, pregnant women should consult their doctor before use. Kiwi. Kiwi contains actinidin, an enzyme that aids digestion, promotes bowel movements, and relieves distension. Certain foods, like legumes, can be difficult for some people to digest due to their oligosaccharide content. These carbohydrates are not broken down in the digestive tract and end up feeding gas-producing bacteria in the colon. To ease discomfort, introduce legumes slowly. Start with small amounts and gradually increase to help your body adjust. Choose smaller legumes. Lentils have lower oligosaccharide content and might be easier to digest. Rinse and soak. Rinse canned legumes and soak dry ones to reduce oligosaccharides. FODMAPs, a group of carbs that includes oligosaccharides, can also cause bloating, especially in individuals with IBS. A low FODMAP diet might help identify intolerances but should be followed under a dietitian's supervision as it restricts many nutritious foods. Chronic constipation can cause abdominal pain and bloating. To combat this, increase fiber intake. Include both soluble fibers, e.g., oats, chia seeds, that soften stools, and insoluble fibers, e.g., green beans, nuts, that bulk up stools. Stay hydrated. Drink 1.5 to 2 liters of fluids daily to help fiber work effectively. Move regularly. Physical activity, like a 10 to 15-minute walk after meals, can aid digestion and reduce bloating. Manage stress. Stress can slow down digestion, so finding ways to relax can improve digestive health. Speak to a therapist if needed, especially if experiencing excessive stress or hormonal fluctuations. High salt intake can cause water retention, leading to bloating. The remedy is simple: drink more water. It helps flush excess salt from your system. Monitor salt intake. Most salt comes from processed foods, so be mindful of your consumption. We swallow air throughout the day, which can contribute to gas and bloating. To reduce swallowed air, eat slowly. Chewing thoroughly and eating mindfully can help. Avoid carbonated beverages. These drinks increase swallowed air. Skip the straw and gum. Drinking through straws and chewing gum can also increase air intake. Bloating and abdominal discomfort are complex issues, but understanding their causes and implementing these solutions can significantly improve your comfort. If you enjoyed this overview and found it helpful, please give the video a thumbs up. Thanks for joining me, and see you next time.